Okay, sorry for the delay, y'all.
No problem. We were talking about you behind your back while
Okay,
you were
I
gone.
can.
Fair enough, right?
Fair, totally fair.
Okay, so here we are. This is the Shutesbury Board of Health. It's August 3rd. We have, not only we have a quorum, we have the whole board, and I'm supposed to tell everybody who might be listening who's here. So we have me, Catherine Hilton, we have Garrett Simonson, Arlene Reed, Wim Levine, and Noreen Pease. Everybody here. And can we approve the minutes from last time, whenever that was? It was a while ago, I think.
I move to approve.
Second.
I guess we better take a roll call vote. I'm Catherine, yes. Garrett,
Yes.
Noreen,
Yes.
Wim,
Yes.
Arlene.
Abstain, I was not at the meeting.
Okay, all right. All right, there we go with that. Let's get the business parts over. 56 Wendell Road. I forwarded all to you all the email that we got from Greg. He's obviously working on it. The delays seem to be, as usual, not his fault, but he, things have not moved very far. But do I hear a motion to delay action on this matter for another month?
So moved.
Second.
All in favor? Catherine, aye. Garrett,
Aye.
Noreen,
Yes.
Wim,
Yes.
Arlene.
Yes.
Right. 2 ayes and 3 yeses. I don't know why I said aye, but okay. And the other item of business is 44 Old Egypt Road. They have a failed septic system. They are repairing it for sale. They want to start tomorrow. Charlie's reviewed it. He's happy with it. They've paid the fees. May I go ahead and issue the permit? Garrett?
So I'd move to approve.
Oh, okay, we'll do it that way. A second?
Second.
Second.
Okay, let's vote. I'm voting yes. Garrett?
Yes.
Noreen?
Yes.
Ma'am?
Yes.
Arlene?
Yes.
Okay, so be it. I think those are the only actual business items, right? We've got things to talk about. Oh, let me check. Yeah. Okay, how do I make this come back? Whoops. Oh. Sorry, I couldn't figure out how to make this big again. So tell us about the grant. Noreen, did you go to the organizational meeting?
You're muted, Noreen.
Thank you. Yes, I did go to the organizational meeting, and we're trying to schedule some more organizational meetings. They're going to be weekly for a while, and then I think we have to meet according to the grant rules once a month. We're working on a time that all 6 towns can attend, and we're hoping for the next meeting next week. But what I did learn is in this grant, we are getting the time of 1.5 nurses. And we sort of have to prove our worth as a new member of this, granting entity before we can request social work time. So that might come in a grant down the road next year or following, and we'll learn more about that. Jen,
Noreen,
go ahead.
when you say prove our worth, do you mean prove it to the granting agency?
Yes, we will need to meet all of our objectives and all of our stated, criteria in the grant. And I feel certain if we are, then they will entertain requests for additional funding or additional staffing
And
at that
may,
time.
may I ask for clarification? When you say we, are you referring to the collective communities that are covered under this grant, or are you speaking about Shutesbury?
I am talking about the collective 6 communities
Okay.
under this grant. So the grant in general is almost $300,000, Arlene, and it's
Mhm.
covering part of a grant manager's salary, 1.5 nurses, some equipment. I believe all of Jen Hoffman's time is
Mhm.
is provided through the city of Greenfield.
And
And
are
that pretty
those,
much,
are those resources shared equally among the communities or on some
That-
other
that's-
prorated basis?
I don't know. That's part of what we're going to be talking about. I believe when Kat and I submitted the request, we requested half a day a week of a
Mhm.
nurse.
Mhm.
And I think we did the same of a social worker. So that's part of what we're going to be talking about when we start to meet. What people need, how often they need it. I guess, of course, we're first going to have to hire these individuals, and that might not be an easy task. But I was going to go on to say that Jen is meeting with the Office of Local and Rural Health this week to learn more about what is expected of grantees. So she'll have more information at upcoming meetings. We don't have a whole lot yet. We don't have the money yet. It's very preliminary, just trying to get organized and
Mhm.
get information from everyone at this
Mhm.
point, Arlene.
Okay, thank you.
Is there a budget yet for how this $296,000 for the year is to be spent?
Yes, and
or-
I believe we got a copy of that when the grant request went in, and Jen had to make a few modifications, and I think she sent it to us, and I believe I forwarded it to you, Kat, but I can do it again.
Okay,
I've got a
I'll
whole
check on
separate
that.
file now just for, information on this grant. But yes, I can forward that to everyone again if it would be helpful.
Yeah,
So
it surprises me that it doesn't go far enough to cover a social worker.
I think that we were told, I think that was one of the modifications Jen had to make, that we had to pare back that request until some of these new entities or groups, and we are a new one, have some more experience and they see how we operate, and they, know that we're actively meeting and we're trying to meet the goals that we established in the grant and so forth, before they let us grow.
Right, yeah, it wasn't about that so much as the actual budgeting for it. And
Yeah,
So
I can find that and forward it to everybody again, what was in the budget, but it's not specific per town yet, or how we're going to use the resources in the town. That's for all of us to have a discussion for how that unfolds. The other thing that's going to be happening, and I don't know if others want to attend this, but Michael Hugo is, I think he's the executive director of the Massachusetts Association of Boards of Health. Do you know, Garrett? Is that right? You don't know?
No, the name's
Okay.
not familiar to me.
He is going to come and talk to the group as soon as we, get a meeting established and have a time to invite him. So if anyone would like to attend that meeting and get more of an overview, I think that would be a good one to attend, and I can let you know when that's going to be happening. The other thing Jen said she's working on is developing letters of agreements among the towns for signature, which we can, I think the group, again, that's meeting on a regular basis will discuss those letters of agreement, and I can also share those when that draft comes out so we can see exactly what we're agreeing to. I imagine it'll probably be some sort of template for memorandum of agreement that Greenfield has with other towns, or there may be a template that the state provides. I don't know yet the details on that, and I'll know more soon.
do we sign that, or does the select board sign it?
I don't know. That was a question that I had for you, Kat, but I've got it in my notes. I don't know. So that's a good question. We might want to, it seemed to me, I haven't mentioned this grant to Becky. I don't know if you have. So we should probably just give her a heads up that we're participating in this process. And, we may need it signed by the select board. I don't really know at this point yet.
Yeah, I
the
haven't
other
talked
thing-
with Becky about it.
Okay, I can do that if you want.
Either way.
Which is, did we vote last week for me to represent the board, Kat? I can't remember. Do you remember, Garrett?
We didn't meet.
Oh,
Remember,
right, but last
we
time,
canceled the meeting and you just agreed that you would do it.
I did, so I just wanted to make sure everybody was okay with that. And I believe I saw in a note that Garrett provided that he would provide backup if needed.
Yeah, I'm happy to do that. I know you're between that and the group
Mathco.
work at Mathco, yeah, that you're attending a lot of meetings, so.
Yeah, okay, great.
So why don't we do this by vote? Why don't we vote that Noreen will be our representative to this grant committee, whatever it's called, and that Garrett will be her alternate.
Yeah, I don't know that we have a name yet. It's called the Public Health Excellent Grant.
Okay, can I have a motion to this effect?
I move that Noreen will be the Board of Health's representative to the Public Health Excellent Grant, and that Garrett will be the second.
I second that motion.
All in favor? I'm in favor. Kat and Garrett, you can vote for yourself. It's all right.
Yes,
Noreen,
Yes.
Wim,
Yes.
Arlene.
Yes,
Okay.
I have one more statement is part of this whole process in public health is to try and get everybody who's on a board and people who are health agents, try and get better training and education for them. And potentially down the road, there's going to be credentialing for all of us. Given that they want a baseline of what kind of credentialing each of us have, and I think Arlene and Garrett and I have already sent that to Jen, so
I did too.
you did too, okay. And
I told her I didn't really have any credentials, but I suppose I do. I didn't think about this. I took ICS 100 and 700 and stuff like that.
and only 30 years of experience, Kat. So
Pardon me?
right.
30 years of experience.
There is
Well, I
that.
did mention that.
Okay, good.
Right, but I mean, that's not credentials specifically.
I also bring this up because I don't know, I know Claudia was facing some health concerns, so she needs to get forward hers when she has the opportunity. If you do talk to her, Kat, would you ask her if she would do that?
I will ask her to do that.
Okay, great, thank you. Does anyone have any other questions about the grant? I have just a little bit of information from the Public Health Roundtable meeting that was, I don't know, it was a while ago now, but we had a presentation by the Opiate Task Force for the eastern part of Franklin County, and it goes into some of the Worcester counties, and there's actually staff for this task force, which is great. So they can provide information and support to individuals and to communities if there are opiate concerns and opiate deaths in this county. I don't know if anyone follows this data, but they're on the rise, and we had 49 deaths in Franklin County and the last calendar year, which kind of shocked me.
Mm.
The other thing I found particularly interesting about this presentation that is an issue in this area is that apparently a drug of choice right now is a horse tranquilizer, and I didn't exactly catch the name of it. I don't know if anyone else is familiar with it, but the reason I'm mentioning it is that it does not respond if someone takes that particular opioid to Narcan. So that may be something that I should share with Kristen, I don't know if she's aware of that, but I thought it was important information
Yeah.
to know
It's
and to provide.
Probably not an opiate then. If Narcan is not an antidote.
Okay,
So it might be, is it Molly?
maybe.
Yeah.
Are you familiar? Is that a horse tranquilizer that you're familiar with?
It,
Win?
not
No,
through,
I didn't mean personally, but maybe you ride horses. I don't know.
I do know that it's a very popular substance of abuse.
Okay, all right. From your experience at the jail, I imagine.
Yeah.
Yeah, okay.
It might be ketamine.
That sounds like it. I think that's it,
Yeah.
Arlen.
Yeah, which is probably yeah, it's probably really dangerous also because it's bootleg manufactured, it's not like
Yeah.
a pharmaceutical grade drug.
Right. Okay, and just the other thing I have to report is Meg Ryan is our contact. This is probably important for you to know, Arlene, if you need resources, if anyone shows up with monkeypox in the area, and so far Franklin County has no cases.
So I'm sorry, Meg Ryan is.
Meg Ryan is one of the
Yep.
public health nurses at FERCog.
Okay. And she is the contact person for all
Yeah,
things related.
she's going to be, be the most knowledgeable person in the county, public health wise, on monkeypox.
Okay.
Wish they had given it a more dignified name.
Can
I
you,
know.
can you, when you get a chance, Noreen, can you send me her contact information? I might have it already, but I'm not positive that I do.
Yeah, I don't have her number right off, but
Okay.
I imagine she's probably listed on the FERCog website
Sure.
under public
Okay.
health. Yeah.
Got it. Okay.
And I said I was finished, but the other thing that came up this week, just some friends of mine have needed testing sites for PCR, and there aren't a whole lot around, but GCC has one 2 days a week. Apparently there's another in Shelburne Falls and one in Deerfield. And if you go to the FERCog site, that will tell you when those sites are available for PCR. And there are still sites. I know there's a site in East Hampton that's open every day except Sunday for limited hours. And well, there isn't a waiting line or anything of that sort. So I was going to say accessible, but maybe not so accessible if you live in Shutesbury.
Right. Okay. Thanks.
I'll assemble those sites or some kind of link to them and put them in our message at
Okay.
the end of the week.
That would be great, because I think people are, from my experience with my friends, have been trying to call, drugstores and pharmacies, and they're not doing anything of that source. So I think the primary sources are public health sources right now.
Mhm.
That's all.
Thank you.
Is there anything else we're supposed to be talking about?
Do we have any further information on the pizza?
Yeah, right.
Thing that came up?
No. I did talk with Claudia about it, and she agreed that the guy needed to get licensed for that site, although he's licensed somewhere else for, professionally. Last thing I saw was he had put up on Nextdoor, no pizza this week. I'll let you know when I start up again. So presumably that's in progress, but I haven't heard anything direct.
But there was a communication that went to him.
I believe that Claudia got back to him.
Okay.
That's why it was no pizza this week. He didn't explain in his post. But Claudia said that she would follow up on it.
I'm just looking at my notes again, and I apologize, but there was one more staff position in the grant. There is a health inspector agent that is to be shared between the 6 towns too, and that person can provide some backup for towns, when people are on vacation and that sort of thing.
Okay, that's starting to add up
Yeah.
more sensibly.
Well, right, and there was some money for staff training and software licensing, and all of that stuff is expensive these days as well.
And is all this going to sort of be run out of Jen Hoffman's office?
Yes, yes.
Well, is there anything else that needs to come before us, do you think? Arlene, I don't know if you were on yet when I was saying that I am Zooming from the new Board of Health laptop.
Oh, I did not hear that, but great. That's right. Usually we see you trying to juggle computer and phone at the same time, and here you are.
Right.
I didn't even realize that, but yeah.
Yeah, we have this
Excellent.
nice laptop. It's easy to use for
Good.
Zoom, and it's meant to be easy to use at town hall for the hybrid meetings that we may
Okay.
be going on to have.
May I say, it's long overdue. They should have provided you with this ages ago. So glad to know.
Well, I
that-
should have asked long ago,
Yeah.
but as usual, we got a hand-me-down from the land use clerk, Lisa Stratford,
geez.
who owned it, or who had access to it for 2 weeks, and then she quit her job after only 2 weeks, and it's just
geez.
been sitting around since
Okay.
then. And I agreed that that we would accept it, and in fact pay
Excellent.
for it, because it came from last year's budget. So it's
Okay.
like free money for us, because we didn't, it doesn't
Sure.
affect our budget now at all.
Excellent. Good to know.
Yeah, so that's cool. So, apparently people really want to continue remote access to meetings. The public really wants this. And I guess when the legislature said, let's go back to in-person meetings, there was a lot of pushback. And so Grace thinks that there's going to be some kind of requirement for hybrid meetings or for greater access in the future. And I just don't know how that's going to happen, because for each hybrid meeting, you have to have a whole bunch of equipment and appropriate screens and so on. And on any given, you remember what it was like having in-person meetings in town hall. On any given night, there are at least 2 meetings, sometimes 3, sometimes 4, and occasionally there have been 5, and people have actually had to have their meeting out in the hall because there aren't any rooms left. And how all these meetings are going to become digitally accessible to the public, I really don't know. But it may be that it will be mandated. At one point, I didn't get all the details about this, but at one point, before the legislature said, okay, let's just extend the remote meeting rule until March of 2023, they were putting together some horrible, truly horrible requirements in a bill, including, every meeting had to be hybrid, and there had to be remote access to the public, and they were going to assess large fines for even accidental and trivial violations of the open meeting law that had to be paid out of the pocket of the person who violated them, and town funds couldn't be used for it. And I hope that they're not going to try to go and do that sort of nonsense, because that is really really counterproductive. And, you know, you can violate the open meeting law without even realizing it.
Yeah, and it seems to me that if something like that were put into place, nobody would be willing to serve in a volunteer community on a committee or board.
That's a good point.
If that were the burden that an individual resident would face, volunteer on any board or committee, you know, who in their right mind would put
Right,
themselves in that
right.
position?
There would be a mass resignation.
I would agree.
So anyway, that's what I've heard.
Yeah.
So if we're done,
I have one more question.
Yeah.
Are we all out of test kits? Have we pushed all
oh
of our?
no, I meant to talk about that. Thanks, Garrett. No, the test kits are going begging. We got 3 boxes containing 90 test kits each. I gave 50 of them to Becky for use for town hall employees. And last I looked, the first box isn't even empty,
Mhm.
which means we have like 200 test kits left out of like 270.
Let's
So
put that in the next town announce, the next.
well,
BOH announce or whatever.
I'm thinking that maybe we should, you know, lift the limit or something, so that the people who want them could have more,
Mhm.
because I mean, nobody seems to want them. There was a little run on them in the first couple of days, and now
Mhm.
they're just not moving at all. And I didn't push it for a while there because Grace went on vacation, and I didn't want to dump it on somebody else. So what do you think would be a good limit to or should there, I mean, we can't have no limit, so somebody will come in and like take 50 of them, but
What did we
What's the
say?
current
before?
limit?
it's currently 2.
2 per person,
Household.
per
2 per
per
household.
household for
Yeah.
what time frame?
We didn't have a time period. We thought they would all go, you know,
I see.
but they're not moving. I don't know why.
I don't know,
And there
4
are 2
household?
per box, Kat,
Yeah,
2 tests per box.
right.
Well, I think we should go to at least 4, maybe 5.
Sounds good to me.
So we say 5. Okay.
Sure.
All right.
Do we know the expiration date of them?
The expiration date on them, the original expiration date has actually passed. It was July 28th, but those expiration dates have been extended by 3 months.
Okay, so we
And-
want to get rid of these within 3 months. a little
Well,
less.
that's probably a good idea. On the other hand, they're going to keep testing them for continued usability, and they may extend them beyond that.
Mhm.
So they are provided with a QR code,
Mhm.
which I stuck them on during the election in at the end of May. That anybody can, I mean, you can scan it and find out what the current expiration is. And I think I put that on the website also.
Okay,
And they are available at the farmer's market still? Or where?
oh, interesting.
You know, I haven't done that for the past couple of weeks because I had meetings on those Saturdays and I couldn't do it. But we could go back to doing that, I think. Or I could ask Becky to pass them out because she's there.
Is there any logic to involving the library as a distribution site?
The only problem with it is that we've been checking off the households, you know, like as they do when they distribute the trash bags. So, but that's starting to seem like such a non-issue
Mhm.
since people aren't taking them, that maybe we'll just quit doing that and just
Or we
hand
could-
them out to anybody that comes
Or
in.
if there's a way to share the document, make the document where names get checked off or households get checked off, make it shareable to
Yeah.
a variety of distribution sites. I mean, even the AC could be a distribution site, or you know, just thinking about who are the allies here. And when school opens, it could be that the school, I mean, like I said, just thinking about the different places in town that are allies to public health, and
Yeah.
the school, the library, even potentially the AC, if there were a shareable document on which household names get checked off. Possibly. I'm just
Well,
thinking out
also,
loud.
I mean, we could consider just not checking names off and just handing them out to all and sundry, maybe
This is true.
only 5 at a time, say,
Right.
but, or 4 or whatever,
Mhm.
but not bothering to
Mhm.
check them off. Of course, I suppose somebody could go around to each one of those places, but really at this point, I wouldn't care because,
Right.
Yeah.
Who's
Let's get
motivated
them
to
out
do
there.
something like that? Yeah.
yeah, better they should be out there than sitting in
Right.
town hall in a box.
You know, if
Right.
somebody's really excited about swabbing the inside of their
Yeah,
nose
yeah,
for the next 10 to 20 days.
Right.
Or selling them on
fine.
the black market for COVID tests, right?
Right, yeah.
Yeah. Mhm.
So what do you think? Should we just give up the check off and just hand them out?
Fine with
Yeah,
me.
because more, I can't believe that more are not going to be made available in the future.
Mhm.
Right. Right, and possibly ones that are going to be more focused on the new
Or the-
variants, because people are
Yeah.
talking about more false negatives now.
Mhm.
It's not reading the new variant.
Mm.
So better we should just get them out there to be used while they're still somewhat useful.
Yeah.
Yeah, absolutely.
Yeah. Otherwise, we'll end up throwing them away, and who needs that?
Right. Well, I'll ask Mary Ann if she will take some at the library to hand out.
Mhm.
And I'll tell Grace to just hand them out to anybody that asks. And
I probably in the next couple of weeks am going to have some communication with the school nurse, Katie Harrington, and Jackie Mendonça, the principal, and I can throw it out to them as well as to whether or not they would like to have a supply for families of children at the school. Okay.
okay, so this could, I mean, this could, if people actually take them, this could make it go fast.
Just one other idea, Kat, and we can wait on this, but the Lake Wyola Association second meeting is, I think in 2 weeks from now. So if we have some left, we could give some out there too, possibly. I mean, they're not all town residents, but they all have.
They're
pay
here.
taxes here.
Yeah, I mean, they're here and, facing the same risks and carrying the same risks as the
Yeah,
rest of us.
so if we have a few left, and maybe by then, Arlene will know if the school wants any.
Right. Okay. Now, do we need to vote on all this or can we just do it?
I don't think it's a thing that requires a vote,
Okay, good.
in my opinion, but
That works for me. I'm glad you brought that up, Garrett, because I forgot to write it on the agenda. And every time I go into town hall, there's these 2 big boxes of tests. Okay. Are we done? Okay. Motion to adjourn?
so moved.
Second,
All in favor? I don't think we have to actually have a roll call to adjourn. Let's just say, yes, let's do
Yeah.
it.
Yes.
Yes.
yes,
Okay, thanks you guys.
Thank
thank
you.
you.